Hello. Hello, everybody. Welcome to FriendsDay Wednesday. So I am so excited. Today I get to introduce my friend. I don't want to say new friend. We've been friends a long time,
We've
Karlene.
been friends a long time.
We've done some oh wow, a long time. Okay, let's not go into years. Um, so Karlene, you and I met through Pam
Right.
Vanderbilt.
Yep.
And you have spoke at our retreats. You've done just a bunch of stuff with us. You also teach your own denials into dollars webinar. Nope, not webinars. Conferences. Oh,
We do webinars and we do like Medicare and TRICARE webinars, and we do all day commercial plan seminars.
nice. Yes, because you really focus on um, holding the payer accountable, making sure that they pay the provider what they are supposed to based on laws, not based on contracts
Or policies.
or
Yes.
policies. Nice. Nice. So tell me, what are you up to these days? And you're in Georgia and you go around, you speak, you've spoke at AMBA, you've spoke at AAPC, you speak at GAMGMA. Did I say that?
GMA local chapters, AHEMA, not AHEMA, AHAM, uh, specialty associations, and HFMA.
Nice. Now you're doing the orthopedic summit in June, right?
I think so, yes.
Yes. We think so because we're not sure what it's called.
Right.
But and you are speaking at our reverse retreat in June,
I
which is
am.
a virtual event. So
Yes.
yay. Yay. So what are you up to? What's happening in the world of Karlene?
I
What's
just
a
attended a
hot
great.
topic?
I just attended a great coding and compliance seminar, cruise seminar, or conference, cruise conference. Um,
Is that
with
the cruising in the Caribbean with
it is,
Christine Hall and Sterling Global?
it is. Yes, it was great. And of course, every day I'm keeping up the tough fight to the insurance companies to pay what they're compliantly and legally supposed to pay. So keep my boxing gloves on.
Yay. Now there so you and I are on a list served together, right?
Right.
And there's been some conversation about, I keep getting, not me, but people are saying that they keep getting requests for records, or am I really supposed to, the patient has United and this record request comes from Cotivity. Is that HIPAA compliant? Is that compliant? Do I have to respond to that? What would your response be to that?
Well, first you need to be able to assess and address if the request is non-compliant, which everyone I have seen does not meet compliance. It is the obligation or responsibility of the payer to protect their patient's PHI and to ensure anybody that is asking for those records is meeting all the HIPAA privacy protections that are required to release that data, which includes the patient's awareness, the patient's authorization, what specific dates of service, and not a broad range of dates, because a broad range does not meet compliance. What within that specific date of service are they looking for, and for what exclusive purpose are they looking for it? And if any damage will be incurred on the patient. For instance, which is commonly what I am finding is these medical record requests are commonly a two-part scheme. The first part of a two-part scheme, the first part being request for the medical records, and then the second part being an offset process.
Oh,
So they're basically, what I'm finding is they're basically doing it to justify their recoupment process. And I don't believe the records are even being reviewed. And so in that recoupment process, they're offsetting it against non-party claims and non-party plan claims. So that, which doesn't meet compliance, that there doesn't meet compliance according to the department, even according to the Department of Labor secretary.
Okay. So let's say I get a record request from one of these third party record people. What should I do? Like, what should my response be? Is there a response?
Yeah, you do need to respond. You need to address the fact that it doesn't meet compliance.
And I can send them a letter.
Right. Respond with a letter, and let them know that it doesn't meet compliance, because a broad-based request is your first indicator. And a second indicator is that they'll claim that it's for risk adjustment. And then down in the letter, they may put or for any other purpose. They can't have carte blanche access to PHI and use of PHI. HIPAA does not agree with that. And so you can send a letter, address the failure to comply, state the things that I said, that in order to meet HIPAA privacy requirements, which you are required to do, you need the patient's authorization under the requester's letterhead. And
that would be the payer.
No. For instance, day before yesterday, I received a call from a party who claimed to be working with Aetna, and they were doing a commercial risk adjustment. Well, that was my first red flag, because there is no commercial risk adjustment. And so we addressed the fact that they were making false and misleading statements to inappropriately gain access to PHI. After going back and forth with her, I asked her, and this is the biggest key, always ask them for the law that supports what they're doing.
Oh, okay.
And it's not the law of HIPAA. Of course, there are laws with HIPAA, but it's the law of that governs the handling of that claim. And with that, even if it's a Medicare Advantage or a Medicare plan, you have a right, especially with a Medicare Advantage plan, you have a right to receive, under all rights of disclosure, a copy of the CMS letterhead with the list of patients' names and their traditional Medicare ID numbers to support that it is a valid request. But what I was dealing with the other day, after going back and forth, I asked for the specific law this girl was relying on, or this lady was relying on. And in the going back and forth on that, found out she claimed to be working with Episource, which, keep in mind, Episource has been proven not to safeguard PHI.
Oh, okay.
And also keep in mind, you may have a BAA with United Healthcare, but you do not have a BAA with Optum, and you do not have a BAA with Episource. So even if you did, they never provide that. But what I ended up finding out is this person did not work for Episource. She had been given this request by Episource, but she was working in an undisclosed offshore company. So it gets pretty deep in how they're trying to gain access to these medical records with sensitive PHI. Also keep in mind, your practice may have at some point spoken to that patient about, let's say, anxiety or depressive disorder without being mental health even,
right,
or something else that, about, how many drinks do you drink a month? How many, do you take any street drugs or illegal drugs or whatever it might be? That then turns that medical record, which you already have protected PHI, but it's more sensitive PHI at that point. And if you release that and that patient is harmed, that's going to come back on you.
That's right.
So you need that patient's authorization to release medical records. Or if you release those medical records to United Healthcare last year or Optum, And then they had the major cyber attack. Many providers don't realize that there was a thing going back and forth as to who was going to have to notify those patients that were impacted by that compromised system. And it ended up having to be Optum, but Optum was wanting to point it to the providers to be the ones to notify the patients of the compromise.
Right. Although the providers weren't the problem. It was
no, not at all.
It was Optum. They got compromised.
But they did release those medical records without the patient's authorization.
Right.
So they could be held for some accountability of that.
Correct. So you teach this, right? Like that's part of your all-day seminars or webinars. And
correct.
So if somebody really wanted to know we're getting inundated with these medical record requests. How do we handle those? Those are things that you teach so that people know how to handle them. You would help them or show them how to write those letters to making sure that they are citing or sourcing the right information. So it's I'm going to say a legit letter, not just something I'm going to write up quickly, right? And I'm going to say this, I've not tried this, but you probably don't want to rely on Chat GPT or AI to write that letter for you.
No, so do not do that. I have seen them where they did use that, and it was not correct, and it put them at more risk.
Then it had fun little emojis in it.
And other statements that could put them at risk. We have an upcoming Medicare Advantage webinar and an upcoming TRICARE webinar. But in our Medicare Advantage webinar, we address the medical record requests, and we provide a resource template to use to respond to those medical record requests to make sure that they are done with integrity and not with an underlying intent, which most of them, if not all of them I've ever seen, has been done. So
it's kind of a done for you template that you create.
Copy and paste to your letterhead.
There. So that makes it easy. And I'm going to say easy, but yeah, you would just need to adjust it per payer, per request or whatever. But
correct. You usually
got all the body of it.
Yeah, you just have to do one letter per letter ID number or outreach ID number, or multiple outreach ID numbers. You can just use the one letter as long as you list the letter ID numbers or outreach ID numbers.
Nice. How cool is that?
Yeah. And if they don't comply, then you have the ability to report them, as it states, to the appropriate governmental agencies, including OCR.
And that's the Office of Civil Rights.
Correct.
Civil Liberties. That's not right. But this is just one of the many things that you teach when we talk about the providers getting paid and keeping their money, right?
Right.
You also talk about denials and how to overturn those. You also talk about how to write an appropriate or a binding appeal letter.
Yes.
And one of those, and I can't remember, I mean, we just had this conversation. I can't remember you're doing one of them at the reverse retreat in June.
Yeah. Turn denials and timely filing denials.
There you go.
So basically, if you rendered a service in good faith and you billed it in good faith, you're due that the benefits that are owed to that patient. And the laws support that. Insurance companies know that, but they literally bank on the fact that you don't. So they come up with creative policies and contract provisions and all, denial tactics, especially right now, because you have a lot of litigation going on against the insurance companies or governmental fines going on and class action settlements. So they're trying to use this medical record request scheme, two-part scheme, to be able to recover unexpected losses due to these litigation fees. And they hope you don't know that, and they try to intimidate you. So when you know what the revenue protective laws are, they supersede the contract provisions. They supersede the policies. They supersede all of these creative demand letters and all of that.
Well, so talking about contract and policies, if I am a provider and I'm contracted with Blue Cross, what if I'm contracted with Blue Cross and Blue Cross says I have a timely filing of 6 months? That's what my contract says. That's what I've agreed to. How does the law, like, how do I get out of that contract?
That's a
decision. The law says it doesn't mean it's true. I mean,
right, but it's not that you necessarily have to get out of the contract. You just have to hold them accountable using that same contract. So if you go to the provision on governing laws, it clearly states that the patient's plan, the federal and state laws supersede any provision within that contract that is in conflict with such laws.
So it could be, yes, I have a contract with Blue Cross, and as long as I don't know or don't look at or pay attention to the governing laws, then I'm holding myself to the contract because yes, I haven't done the research to say, yes, I have a contract and yes, I'll do these things, but oh, by the way, there's state and federal laws that prohibit some of those actions, and so therefore I'm really going to hold to the law, not the contract, because a business contract can't supersede a federal or state law.
And it even says it in every contract, and that's the contract of governing provisions. And so when you learn what all the revenue protective laws are, whether it's TRICARE, Medicare Advantage, or commercial, those laws plus the patient's plan document or the patient's contract supersede those provisions and policies and all of that are in conflict.
That's all that stuff that you teach in your all-day seminars about yes, ERISA and those laws and how to apply them correctly. And some of it applies out of network and some of it applies in network, correct? And
correct.
You talk about how to handle those and I can see the whole Mickey Mouse gets $1, but we're giving it to Donald Duck thing, which is a great illustration that you do. It always makes me giggle. But that's what you're teaching, because sometimes, and I'm going to say this carefully, sometimes even as coders, billers, auditors, compliance officers, if we don't know the laws, we are doing a disservice to ourselves, to our providers, because we're adhering to the contract, but the laws are so much bigger and have so much more bandwidth that if we looked at those laws and held the payer to the laws and our providers accordingly to the law, our providers would be in a much better situation.
Correct. We're all working in revenue cycle or any aspect of revenue cycle. We're all advocates for our patients and for our employers, who are healthcare employers, or if we're billing companies, which we do billing on the side for surgical assistants for our billing clients.
Right.
And, that's part of our job as being advocates, and we need to be well equipped to be able to protect them against any deceptive business practices or deceptive denial tactics and demands that are made.
Yep. I mean, we're talking about this, but you do this in real life. Like, you have actually gone through the process. You've actually been successful. So I'm going to put you on the spot, Karlene. Tell me the highest dollar, if you can remember, if you think about it. Tell me the highest dollar you've recovered for a provider.
Close to $1 million.
How many?
Close to $1 million.
That would have just been written off.
Yes.
Had you not gotten involved and fought for that provider, right, using the laws that you know to use, that you then teach across the country in your all-day seminars. So that provider got $1 million because you knew what you were doing and you knew the laws and could do that for him.
Yeah, I had one provider to actually fly up and ask to meet me at a local airport, and I went to meet them, and they were actually there. I thought they were just flying through Atlanta and the Atlanta area, and they were there to meet me to give me a check of the 2 accounts I got overturned for them, and those were pretty hefty checks.
Was that, and I'm just going to say, from, was that just validating? They hand you, first of all, provider flew there to hand you the check because you did such an amazing job and you got their practice the money that they had already earned. You fought for that and got them the money that they had earned, and they got paid for that. That they bring it to you because it was a significant amount of money. I bet you drove away from that meeting just like, this was so amazing. I got paid, but just validated that you knew what you knew and you did what you did and you got it, and everybody came away from that, and you fought for that provider.
Right.
And I recognize that.
Yeah. But my biggest win was several years back when I received a call from a man. He spoke with an accent, so I had a hard time understanding who referred him. But his wife her health was it was a life-threatening condition, and the insurance company had denied them the care that she needed to turn it around, to recover. And they had an attorney who still could not get it overturned. And I was their last hope, he told me. So they sent me the documents the attorney had received, and I went through them. And in the documents, I found one sentence. I found several violations, but one specific sentence that made the difference. And I held the insurance company accountable. They overturned the denial. And then 6 months later, he wrote me a letter letting me know that his wife her health was improving drastically, and he wanted to thank me for that. And how I made such a role with that. And I'm not patting myself on the back, because what I do is I use that letter on those days that I feel not defeated, because I tend to be tenacious, but on those frustrating days where I'm, throwing my hands up and going, why do I keep doing this? Yeah. But I get that letter out and I read it and I say, that is my why.
That's why. That's it. Yes. And yes. And you do a great presentation on knowing your why. We did shirts, knowing your why. Yes. Yes. Maybe we need to put 2 on for reverse retreat. Maybe you need to do knowing your why. That's important, because sometimes I gotta say, sometimes in this industry, we just get bogged down and you're like, why am I doing this? Yeah. Tell me again what I do and why I do this. Like, does this even matter to anybody? And then we get
matter to one, and that one is still alive today because of it. So I keep going.
That's right. And she got the care she needed. I know that I have a friend that I called you and I was like, listen, they're having a struggle. And you told me exactly what to do and the questions to ask, because they were not getting a peer-to-peer review in their review. And that was the first thing. And then they shared that with their physician, who now uses it in his practice. So when sources, when the procedures get denied and they have to do that peer-to-peer, the very first question that doctor asks now is, what specialty are you?
Yep.
If we're peer-to-peer, you have to be the same as me. You can't be an ophthalmologist if I'm a urologist.
Right. And now, because since the shooting of the United Healthcare CEO, a lot of these healthcare or physician reviewers are not disclosing their name or contact information. Then how are you supposed to guarantee that they are, number one, a physician, number two, qualified to make that determination?
Yeah.
So that actually supports various levels of healthcare fraud.
So really quick, how do you balance that? I mean, what in a perfect world, we would not have people going on the street shooting each other. Like that's not okay. But in a perfect world, how do we safeguard these physicians, knowing that, I'm just going to give my name to somebody whose wife might be terminal, and my decision affects whether they get their treatment or not. Like, I don't know how to get the happy middle there.
Well, the federal law says they have to disclose their contact information, their specialty, and their credentials to ensure that they're giving appropriate healthcare information and determinations. And because the law supersedes, then they have a decision to make. They're putting themselves in that position to be a physician reviewer. And I've actually had physician reviewers to read my peer-to-peer questionnaire that you mentioned. And one looked at me and he goes, "You are tough." And I'm like, that's my job.
Yes.
But, you know, at the end of the day, if you're in a position that you are fearful of your life, you don't need to be in that position.
Right. Well, if you're fearful for your life because you are saying no to medically necessary life-saving procedures or services, I guess I would say that's the moment you need to question whether what you're doing is right or not.
Yeah, from you know, your conscience has to be
right.
Being hit. Yeah.
I have to be able to sleep at night.
Exactly.
You know, if I can go to bed and go, I did the best that I could and I did right. All right, I can sleep at night. If I didn't
heard
do
way too many people who have worked in the insurance industry make the statement that they couldn't deal with it anymore, that they couldn't sleep at night, they were stressed, and it's just not worth it.
Yeah. Well, you know, from our perspective, we're fighting for the providers,
right,
who have rendered the service. You know, on the other side of it, the flip side, the people opposing us are the payers who are saying, no, we're not going to pay you. And at some point, like that's got to be taxing on a person. No, we're not going to pay you. You've rendered the service. Yeah, you've earned it. Yeah, you deserve it and we owe it. But no, we're not going to pay you. Like at some point, just as a person, as a human, that's got to start weighing heavy.
It's an ethical issue.
Yes.
Yeah.
And we're supposed to have integrity and morals and values and ethics. And, you know, I'm going to say the Hippocrates Creed or whatever, you know, first do no harm. And, you know, when you're in a position and you're saying no, because you're saving the almighty dollar as opposed to saving your patient, you've done some harm.
Well, Dr. Linda Pino, if you haven't heard her speak before Congress, she had a great statement. She said, you know, she worked for the insurance companies and she's now lobbying against what they were having her do. But she made a statement that she took her license was to help people, not harm them.
Right.
Intentionally, you know. And so now she's lobbying against this kind of behavior and acts.
Oh. Well, okay, Karlene, so we have 2 minutes. What is your parting thought? This, by the way, this was supposed to be a chit-chatty kind of conversation. We got kind of heavy. we might have you back for the chit-chatty kind of conversation. But
well, my thought is I've been in healthcare for over 40 years, but started when I was 2.
Yes.
That's my story, and I'm sticking to it. But, you know, I love our healthcare and the rights we have in the United States to receive quality healthcare. And at the end of the day, way too many hospitals are closing needlessly, in my opinion. Too many practices are having to be acquired due to financial struggles that they should not be being met with if the insurance companies were held accountable to pay the benefits they're legally required to pay.
Right. Okay. You are speaking at the reverse retreat.
Yes.
We're going to tell me again. Timely filing denials. We'll talk about those.
Denials into dollars.
And I posted it. I'm not sure if it's showing in the comment section, but you do have a webinar coming about TRICARE and Medicare Advantage. Yes. Is that what I read? You sent it to me.
TRICARE is on March the 12th, and the Medicare Advantage on one, which covers revenue protective laws and compliance-based strategies, is on March the 18th at 1:00 Eastern time.
Perfect.
Both of them are 2 hours and 2 CEUs each.
Perfect. I will see if I can figure out how to get those on there. And when I say me, it really is probably Lexi. Love you, Lexi.
Love you, Lexi.
We love Lexi.
We do.
I will send those to Lexi, but we'll see how we can figure out to get those posted on there so people can reach out to you, because you are MedRev Solutions.
Med Revenue Solutions.
Oh, revenue. Sorry.
Yeah, my email address is medrevenue@bellsouth.net.
medrevenue@bellsouth.net.
Yeah, like a bell you ring. Bellsouth.net.
Perfect. But and if anybody has any questions or wants to reach Karlene, if you can't find her, you are on LinkedIn. They can reach out to you there, or reach out to me, and I am happy to directly connect you to her, because I got your number.
You've had my number a long time.
I've had your number a long time. Yes. And I, looking back on those years really quick, I'm just going to say, I truly value our time together, and, who you are, just how you've spoke to me as a person, but also as an educator, and, how you hold yourself and what you're doing for this community and this industry for our providers. It's definitely needed, and you're doing an amazing job.
Thank you.
Thanks. So, okay, my friend. So thanks for joining us for FriendsDay Wednesday. Karlene, thanks for being my friend. I'll send you your payment later.
We have helped each other in a lot of ways.
I tell people I have to pay my friends to be on here.
No, you don't. Beth has helped me in so many ways, and she knows what I'm talking about. So
it's the friendship payment. I have to pay my friends. But you have a great rest of your day. I have to scoot because I have to take Gary to the doctor because he's been a naughty little monkey. But you guys have a great day. Karlene, I will talk to you soon. Thanks so much.
Thank you.
Thanks. Bye-bye.
Bye-bye.